Good afternoon, and I want to thank everybody for being here today. It's been a busy few weeks here in Missouri. Our state's bicentennial is right around the corner on August the 10th. The First Lady and I have had the opportunity to begin the bicentennial tour across the state last week. We were able to visit several small towns along U.S. Highway 36, and the bicentennial inaugural parade and ball are on September the 18th, and we want to make sure that the public are invited to attend that occasion because it will be outdoors for the first time in our state's history. And this is a great opportunity for Missourians to showcase our rich history. However, today we have some exciting news regarding the Department of Health and Senior Services and Public Health in Missouri. But first, before I start on that, as you all know, COVID-19 cases have been increasing in Missouri and across the Midwest, fueled largely by the Delta variant. Since the very beginning, we have followed the 4 pillars of our state: Show Me Strong Recovery Plan, PPE, testing, hospital capacity, and data. These pillars remain and are fully supporting Missourians as we experience these localized increases in COVID-19 spread. Unvaccinated Missourians are the primary target of this new COVID-19 strain. While the Delta strain is more contagious, the vaccine has been proven to be safe and effective against it. We encourage all Missourians to consider getting vaccinated, as almost all new COVID hospitalizations can be attributed to unvaccinated individuals. We understand that some Missourians are on the fence as to whether to get vaccinated or not, and that is a big decision for many families. That is why we encourage you to engage in conversation with your personal doctor, your local healthcare officials, or other trusted community leaders, so that you can get the facts and decide when getting vaccinated is right for you. Vaccines are available anywhere you go, and they are free. We walk past the vaccine every day in every corner of our state. We must all take personal responsibility and do what is right to protect our own health and that of our friends and our families. We are thankful that 82% of the Missourians 65 and older, the most vulnerable, have received at least 1 dose. However, only 47% of all Missourians have received at least 1 dose. And for our young people ages 12 through 24, that number is even lower at just under 30%. Earlier this week, I spoke with K-12 administrators to discuss how we can educate and encourage vaccinations among younger Missourians. One of the best ways we can move the needle is by having trusted community voices relaying complete and fact-based information to those who you look up to. And let me say that one more time. One of the best ways we can move the needle is by having trusted community voices relaying complete and fact-based information that those who look up to them. Our work on the front continues, but these efforts appear to be working, with vaccine uptake increasing across the state. And when I say that, I want to be clear that we were vaccinating somewhere around 45,000 a week. That number has now closer to 70,000 a week in the last 3 to 4 weeks. We do know that we're getting more requests on vaccine across the state, and people are utilizing the vaccine. To assist our efforts, we are announcing a new COVID-19 vaccine incentive program in Missouri. The Missouri VIP campaign will give vaccinated Missourians a shot at winning $10,000. The first drawing will take place on August the 13th and occur every 2 weeks until October the 8th. Entries will be divided into 3 categories: red, white, and blue. The red category includes Missourians age 18 and up who receive at least 1 dose after July the 21st. The white category includes Missourians age 18 and up who have received at least 1 dose before July the 21st. And the blue category includes Missourians ages 12 to 17 receiving at least 1 dose at any time. Additionally, local public health agencies will receive funds to provide up to $25 in incentives for each individual that chooses to get vaccinated. These incentive programs will complement the state's existing $5 million education campaign, which helps Missourians get the facts on the safety and effectiveness of the vaccine and how to access it. We are hopeful that together these programs will encourage Missourians to explore every opportunity available to get vaccinated. Before I get ready to introduce the new director, let me just say this to Missourians that are out there that's listening. I ask you to turn off the clutter, the doom and gloom scenarios that are out there across our state. All the misinformation is out there. All the people that have a political agenda to talk about this virus. And I ask you to go to your healthcare leaders in your communities, to the people you trust, to your doctors, to your clergies, to people you know that will give you good information and be able to make your judgments on getting a vaccine. I encourage you to do that and then make your decision for you and your family. But that is the way the Missourians will get this done. And I'm dependent on you and your families to make the right choices. We know right now there's going to be a hesitancy, whether it's in Missouri or any other state. But we also know there's people on the borderline whether to get it or whether not. But all the confusion, all the misinformation that's out there today, I encourage you, talk to your doctor, talk to the health experts in your communities, the ones that are truly on the front line, and talk to them and try to make your decisions from that information. Today, we are also announcing the new Director of Department of Health and Senior Services. Selecting the new director was not an easy task in a timely manner. The DHS director has always had a critical, important position in state government. The position is tasked with helping to protect the health and well-being of Missourians, which has been further complicated by COVID-19. We knew going into our search that the new director would need to be able to hit the ground running. After interviewing multiple highly qualified candidates and conducting several rounds of interviews, we narrowed the search to a couple of finalists. Today, I am announcing that Don Karoff as the new director of DHSS. Faith and family are important in any decision that I make. And after my conversation with Don, I knew he understood that. It is obvious that he has a firm grasp on public health issues and the COVID-19 crisis. But more importantly, he knows the value of family. And that is what it takes when you are in the arena. A person who is in for the right reasons and has the capacity to serve Missouri families like they are his own. Don is no stranger to state government and has more than 30 years of experience in public health and emergency management with the state of Illinois. He has previously served as the Assistant Director of the Illinois Department of Public Health. He is also the Deputy to the Illinois Governor's Homeland Security Advisory and Policy Advisor to the Director of the Illinois Emergency Management Agency throughout the COVID-19 crisis. From his extensive resume and core values, we know that Don is the right choice to lead Missouri's top public health agency. And we are confident in his ability to serve all Missourians with respect and the level of leadership that they demand, especially as we face the final hurdles of COVID-19 and address future public health issues. I'll now turn it over to Don to further introduce himself to Missourians and to take a few questions. Don? You're welcome.
Thank you, Governor. It is an honor and a privilege to be the next director of the Missouri Department of Health and Senior Services. For me, this is, as the director mentioned, a long road. I have been in state government, the public sector, my entire life. I understand the values that, as a public servant, we must uphold throughout our career. When being interviewed for this position, it was an easy choice to accept the appointment. This is a governor's office that is committed to the citizens of this state. It was apparent from the first time we met that our mission was the well-being of the citizens of Missouri. I believe my qualifications will well serve Missouri. You may be thinking, why emergency management as a qualification? But today's public health requires someone to be able to make quick decisions, be able to weigh all the options, and be able to arrive at a decision to protect the public's health. Some of the core values of emergency management and public health are the ability to communicate, coordinate, and collaborate. And as we have seen during the COVID outbreak, these are core values that you must be able to attain. When I take office, I'm going to get out and travel Missouri. I want to meet with the local health authorities. I want to meet with healthcare providers. I want to meet with the businesses. I want to find out how we can make a better public health for the citizens of Missouri. And I'm not going to forget the core values of public health. We need to get citizens to resume regular screenings. We need to get citizens to take advantage of those programs and services that they have forgotten or haven't been able to participate in because of the COVID event. Emergency management, public health are synonymous in today's field. Public health is a very diverse field. We deal with regulation. We deal with infectious disease outbreaks. We deal with other issues that impact the public's health. I am anxious to start the job. I'm anxious to work with all of you, and I'm so happy to be part of this team that will be a success as we go forward. Thank you very much.
We'll have a few qualitative.
Let me just make couple of things clear to the media here today, too. Robert Nodell's here, too, if there's any more technical questions we ask. One of the things on the incentive program I just would like to mention, they will make themselves available for more in-depth questions on the incentive process, that you'll all have an opportunity to do that. I think that'll happen in the next, maybe tomorrow or sometime, but they'll have a web site that you'll be able to go in there and ask all the questions you want to ask, and they'll make sure they answer all your questions, just so you know that today. So with that, I'll let Don answer a few questions. We're going to take a couple of questions.
Yes, Don, take a couple of questions, please. Use the microphones, Kirk.
Hi, I haven't seen the press release yet, so I don't have a breakdown on your prior job. Were you at Department of Public Health and Emergency Management, and if so, how long at each, and what was the most recent?
Yeah, I started my career in 1987 with the Illinois Emergency Management Agency. Went to the Illinois Department of Public Health in 1994. At that time, I was responsible for creating an emergency preparedness system within public health because that was a new topic. Went back to the Emergency Management Agency in 2003. Came back to the Illinois Department of Public Health in 2016 to serve as Assistant Director of the Department of Public Health. In that role, I served as the Chief Operating Officer for the agency, overseeing the 1,200 employees and over 100 programs within Illinois in public health. It's nice to know that when talking with the administration and looking at the state of Missouri, how similar they are in the demographics and the type of programs that are run. So this is going to be a seamless transition coming into this position.
Jessica?
Hi, Don. Oh, I'm over here. Hi. Nice to meet you. So when you look at Missouri and its public health, what is one area that you think the state really needs to improve on? And then that same question with COVID-19, what is that one area we need to improve on as well?
Well, we need to improve on, which every state needs to improve on, is vaccinations. The question comes up, how can you improve the public health system with COVID? Get vaccinated. I think the governor was quite specific, is that people need to get the right choice. Don't look at social media. Go to the trusted agents to be able to find the right answers about vaccines. And that's the answer. That's what we need to push. Overall, for public health, I want to get back at the local level. I want to work with local public health hospitals to have a good ground understanding of what are the issues in facing them. I want to bring those forward and start looking at issues such as social determinants of health and other types of issues that are impacting health authorities throughout Illinois or throughout the Midwest, Missouri, and other states.
Missouri is, currently a hot spot for the Delta variant. We're seeing cases rise, nearing peaks of last fall. When assessing Missouri's pandemic response, is there anything you would have done differently?
No, and that's one of the things when we talked very early on is that Missouri has done a great job following CDC guidance. This all comes back to people need to get vaccinated. It's a clear answer. People need to get vaccinated. If you don't understand the vaccine or if you need additional information, seek your medical provider, seek your health authority. They can give you the answers to get vaccinated. So the answer to your question is no. I think Missouri has followed the CDC playbook, and my job is to come in here is to build upon that and see what other things we can do to help increase the preparedness and the ability for Missouri to respond to COVID.
All right, one last question for Don. Jeannie?
Outside of COVID, Missouri ranks in the bottom 10 of states for a number of various health outcomes, such as heart disease, cancer deaths, maternal mortality, stuff like that. What are your plans for improving those kinds of outcomes?
Preventative care is probably my pet project. We need to get out there. Most of the problems that we have is just lack of information. We need to make sure that health authorities across the state have the information to engage their citizens and make sure they have proper care. We need to look at, one of the things we did in Illinois is look at having health departments work together. So if one health authority had issues with any aspect of the program, how can we work through mutual aid as bring health departments together to help each other out? But yes, we need to take a holistic look at the public health system. That was going to be my plan on day one, is come back and take that holistic look at the assessments that have been done across the state, look at the data, bring it back together and bring together the subject matter experts, work as a collaborative team, building upon my emergency management background to be able to have a course future. I won't be satisfied unless Missouri is number one in health, and that's going to be my goal.
Thank you, Don. Robert?
Any questions?
There's been some little bit of uncertainty and confusion in the last couple of days regarding the status of the alternate care site that Springfield Greene County Health Department requested. Can you provide some clarification on what the status of that is? Will that site be set up? Do you know what the timeline is on that right now?
Yeah, we received we received a formal request from Springfield and Greene County for establishment of an alternative care site on the 19th of July. Was when that was received. We have been in consultation with FEMA. This request is being spearheaded at the state level by the State Emergency Management Agency as opposed to DPS, but jointly we've been in touch with FEMA as well as the U.S. Army Corps of Engineers and continue to work on the logistics of that request.
So to be clear, that request has not been rejected by the state?
That request has never been rejected.
Jeannie?
There was also some confusion in terms of the CDC rules on using their funds for an incentive program. Did you square that away? How is this new incentive program being paid for?
The two incentive programs will be funded through a combination of state funds as well as new federal funds. The CDC we've been in conversation with in terms of their guidelines and rules as it relates to incentive programs for the past several days. One of the things that Governor Parson has made clear throughout the COVID response in the state of Missouri was that we were to use as much flexibility and as much willingness to work with our local partners, no matter what they requested. If that took waiving regulations, waiving statutes, removing bureaucracy to get the kind of help that our local communities and our health providers needed. The expectation has been that we do that. And we have that same expectation of the CDC, that they will be flexible and work with us, and we encourage them to do so, and we've conveyed the gravity of the challenge dealing with the Delta variant, and we're very optimistic that they're going to be partnering with us.
I want to ask about the $25 incentive program for the local health departments. Is it going to be for anyone that comes in the door and gets a shot? Do they get to decide that they get to pull a name out of the hat at the end of the week? Are you guys leaving up the rules to them? And then once again, is it for every person? How is that $25 incentive program working? Local public health agencies will submit a plan to the state in terms of how they would do a $25 per vaccination incentive for any individual that they're able to get vaccinated, and the state will take a look at that to make sure that it is within the guidelines, the expectations that the CDC has laid out for incentive programs. And if we're able to approve that, that will be a locally structured, locally designed in terms of what the actual incentive will be. Although it could not exceed $25 in value, that decision will be made by the local agency with approval from the state. So you just have to approve it before they can put it into action? Correct.
Question. Thank you. When I talked to you last, you said that Vizient was there for staffing and all people had to do was ask. Now there's an ask here, or all a local health group had to do was ask local health department. There's ask here on the Springfield part. Is that a Vizient request, and why is that not an immediate granting?
That request has been received by Vizient, and they are working with the local healthcare providers that made that request to get those staff people into the state of Missouri. Just earlier this week, it was requested of us at the state level, because part of that ask is for respiratory therapists at the hospital, and we had a number of respiratory therapists that were willing to come into the state from other states, but there's an issue of being licensed to do so in the state of Missouri. And again, in keeping with the governor's expectation, we were able to turn around a waiver in less than 24 hours to allow those out-of-state therapists to come in here to Missouri and to help with staffing shortages. So yes, Vizient is working with the requesting healthcare providers to grant that request.
Who pays for Vizient?
That the Vizient master contract, and so the prioritization that Missouri has to bring Vizient staffing in the state is a master agreement that the state has with Vizient. However, the individual hospitals that are critical access facilities are eligible for 100% reimbursement from FEMA for that. So FEMA and the federal government, is our expectation, will be funding that staffing.
My final question, Jessica.
All right, thank you. Hi, I'm sorry, over here. So when it comes to how did you guys determine that this would be the best vaccine incentive program for Missouri, and do you think it will be successful at increasing the state's vaccination rate?
We are hopeful that it will, absolutely. We've been in contact and conversation with states across the country, some that have done vaccination incentive programs of all sizes and variety, others that have private sector partners and other incentive programs that have occurred. And what we're looking for is a sweet spot that gets as many people prizes or opportunities to be successful in those drawings in as many communities as possible, as opposed to perhaps one winner or a very few winners in the state that would, that people would not feel like they had a likely chance of success. So in consultation with a lot of healthcare experts around the country and others that have tried various tactics, we were able to use their experiences to inform our decision.
Robert, we have one more question from Kurt, and we need to move to Governor Parson.
What is the total outlay of money for these prizes, all combined?
The total outlay of the prizes will be, I believe, $9 million.
$9 million. And then who does the drawing?
The Missouri Lottery will conduct the drawing in the fashion in which they normally perform that duty.
All right, thank you, Robert. All right, Governor Parson. Mike.
Thank you, Kelly. Let me, Michael, before I get to you, let me just clarify something real quick. On July the 19th, we got a request. There's been a lot of media hype, what happened down in Springfield. Let me be real clear on this. We got that request on July the 19th. Within 24 hours, almost every bit of that request had been answered, was in the process of being fixed. The propaganda that was said down there about something being rejected was totally that. It's the exact thing I said when I opened remarks. People need to get the facts and the truth about things. They need to know the difference between a FEMA request and a SEMA request. And our state agencies have been every day trying to help the local levels, and this is no different than what we've been doing. And that request, within 24 hours when the process of being filled, the things that we had the authority to do, the state actually answered within 24 hours. The rest of it is just total misinformation. And again, we should not be misleading the public on false information. All right, Michael.
Yeah. Governor, you frequently urge Missourians to get vaccination. You also frequently, on the next phrase, say if they want to. Today, you said they should consider. Some people think that when you add that qualifier like that, Governor, you're pulling your punch. That rather than just saying get vaccinated, period, paragraph, end of statement, you add that qualifier on there, and it pulls the punch.
Yeah, I don't think so, Michael. Maybe some people read it that way, but here's the thing I'm trying to make. We are not going to force anybody to take a vaccine in this state. We're not going to mandate it. We're not going to force people to do that. But what we do want to encourage the ones that really are maybe on the bubble, maybe the ones that are trying to figure out, do I or do I not, we want to encourage them to take that vaccine. But what we need right now is good information to those people that they can make good decisions. We know what we're doing right now. The information is out. The numbers going up. A lot of multiple fronts that people are taking more vaccine, and that's exactly what we want. So if the incentive program boosts those numbers, that's great. You know, that's exactly what we want. We just want to make sure people are getting good information to make the decision.
You're still going to add that qualifier, though.
Most certainly. We're not going to mandate anybody take a vaccine. I mean, at the end of the day, we're just not going to do that.
Governor Parson, I want to ask about, you've said multiple times when we've asked you about incentives that you are not a big fan of them. Now you put one into place, and you talked about the data. You talked about that was going to be your number one thing that you really wanted to focus on.
Right.
So is there a number that you're going into this incentive program with that we need to be at 60% by the end of this? Or is there any sort of number that you have talked about with your staff that you want to be at by the end of this incentive program?
No, because we don't know what it's going to do. I think, first of all, it's another tool that we have on the table we can use. You know, some states this has worked, some states this hasn't. What we did is we're probably putting everything in there that we can, doing both formats of incentive. So we're going to have everything on the table and see if it works. But we're going to analyze that every week, every day as we move forward to see if this is working. But I think it's important if it does work and it tries and gets more people vaccinated, that's great. And that's the whole purpose of it. But again, we just got to give everybody the opportunity we can to take that vaccine, even though, again, they're walking past it every day. We just got to figure out how they become more aware, more educated, more have the facts of why to take the vaccine to be able to move forward. And I think that's exactly what the incentive process is.
Governor Parson, I want to ask you also about Vizient. In your original release, you mentioned the number 760 as far as the number of people that would be sent out from Vizient. I have the contract right here, and I can't find that number anywhere in there. So I want to ask you, where is that 760 coming from? And do you think that there's any sort of bottleneck when it comes to asking hospitals to pay out of pocket for Vizient's requests and then having them get the FEMA reimbursement?
No, number one, they shouldn't be paying out of pocket. There's enough CARES Act funding no matter where you go, whether you go through FEMA or SEMA on the contracts. If they had to buy into a certain portion of it, if the state was paying 80% of it or 75, whatever percent of it is, I would think they could take their care funding on the local level of the hospital to utilize it. So I don't think anybody's out of pocket per se with the money that we have there. Vivint's been around here for over a year. They've had the opportunity to use those resources, and now they can even use the FEMA money to get fully reimbursed to use those contracts. So I think if they need resources, they have the opportunity to do that. And my understanding is they are more capable than bringing in those healthcare workers to handle the backlog that you have right now and help with their local healthcare workers.
And the 760, where is that number coming from?
I'm not sure 760.
In the original release from December, it says that Vizient will deploy up to 760 staff members, but that's not mentioned in this contract anywhere. Was that just a discussed number?
I think it'd be on a need basis. What do we need to do that's out there? I don't know. We need 760 people to come in here right now. You know, I think, again, the hospitals are going to make that request and put their applications in, and then we'll decide what that number is. I don't know what that number is right now, and I don't think any of us do. You know, we're still dealing with COVID-19, with this Delta variant. We don't know what's going to happen 30 days from now. So that number could surely change by the time you first start it till it finishes. We just don't know that.
We have time for 2 more, Governor Parson.
Okay.
Governor, there's been a lot of campaign leaders across the state, community leaders going door to door to kind of campaign for people getting vaccine. Do you think that's an important part of this, and do you think you're in support of that?
Let me be clear on that. I think for the local areas to go out there and explain to people about the vaccine I'm supportive of that. I am fine with that. What I want to make sure I'm clear of, be real clear. I don't want federally anybody coming in here with a vaccine, knocking on somebody's door, saying, I'm here to give you a vaccine. That is not the message we need in this state, nor should we. But the local levels have been doing this and have been doing a great job. It is a difficult situation we're in because we knew back in January, before the Delta variant ever got here, that there's going to be hesitancy of people in Missouri and other states that we've been facing. And we're facing that reality right now. So to go out there and encourage people to get the right information and the facts, we're fine with that. But what we're not going to do is we're not going to let federal agencies of some kind come in here and knock on your door and say, I got a needle in my hand, a vaccine, and we're going to give you a vaccine.
One last question. Ashley.
Thank you. Oh, Governor, I think it's actually my, Governor, do you mind if I jump in?
Ashley's got a question right now.
Okay, I'll take the last one then, if you don't mind, Kelly.
Yeah, mine's just to piggyback on hers. I know that some local health directors said that that might have had a chilling effect about, concern about who's coming to my door. Is there going to be anything in the next campaign or in this public affairs campaign that will help educate that? Because some of them are truly relying on people to reach hard-to-reach communities with people in their own communities.
Every local community has to be able to get funding that's come from the federal government to do outreach programs, just like we're doing a $5 million campaign statewide. Every county, every city has the resources, the funding mechanism in place to get that message out, on the local levels and different means. I think that's doable to do if that's what they choose to do. I don't think that's a problem to be able to do that. Again, I think the resources there, it's a matter of just how you do that. Look, when you look at Missouri, whether you're in urban Missouri or you're in rural Missouri, this is a big state. And when you start talking about going door to door to everybody's houses and however that you decide to do that on a local level, it's a tough issue to take on, and it's a tough job.
Thank you, Governor. Just last couple questions here before you go. I have one on COVID. You've been very clear that people should shut out the political noise, listen to their trusted voices. I wonder, what is your message for some Missourians who may trust, let's say, certain news outlets that are raising questions about people getting the vaccine? What do you say to them?
I think for the news outlets that are doing the right, when journalists are really doing it for the right reasons to help people and give them information, I think that's great. And I think if you trust them or not, but let's just be truthful about it. You look at some of the news agencies in this state, it's totally propaganda, what they're putting out on a daily basis, and misinformation just simply to put fear into people's minds and just cause chaos. And you see that. And I don't even mind mentioning them. If you read the Kansas City Star, if you read the Post-Dispatch, if you read the Missouri Independent, that's a George Soros organization or funded through those sources, that is total propaganda that they're putting out to people every day. And it needs to stop. People's lives depend on journalists, you here, telling the truth. And it's not hard to do. All you got to do is just be honest with the real information that's out there and what's true and what's not. But I think that's the thing that everybody needs to just stop and take a breath. So the people that put out what I believe to be good information, just factual information, I hope you do a better job of it.
While I have you, Missouri's in national headlines for the bill you signed last week, Mr. Governor. Is a pardon for Lamar Johnson on the table, sir?
Thank you.
Is it-
We're out of time, and you've already been told that. So you're making your time with raising your voice is fine, but we already told you we're not going to take any more questions, so it's the end of it. Thank you very much, everybody, for being here.